Somalia today is a nation in dire need of assistance in order to become a healthy, functioning society. 10% of the population has no home and is forced to live in camps. 1 in 12 women die due to childbirth or pregnancy-related issues. And along with those issues, 80% of school-age children are unable to attend school. Our organization, TERP Serving Somalia, is dedicated to creating real, positive change in the lives of the Somali people. With the right funding, we will be able to implement programs that will improve the quality of life for millions of people in Somalia, along with putting Somalia on a track for progress towards a brighter future. The first issue that our organization will address is the appalling conditions of internally displaced person camps in southern Somalia. Imagine living a life where a brutal civil war has forced you to abandon your home, and you now live in a tattered shelter alongside thousands of other people. You're underfed, dehydrated, and unsure if you will ever have a real home again. This is the life that over 1 million Somali people are living right now, and we must provide immediate funding to increase the quality and safety of these camps in order to ensure their survival. One of the main issues is overcrowding, which spreads out resources paper thin and causes disease to spread more quickly. $300 million will be spent to construct new camps in southern Somalia to reduce overcrowding and improve overall quality in current camps. $50 million will be used to install water filtration systems to ensure access to clean water for drinking and sanitation. The remaining $150 million will be used to send medical supplies and doctors to Somalia to ensure that residents get high-quality medical care. All of these steps will create a better quality of life for millions of Somali people who have no place that they can call home.
Maternal and child mortality rates are the leading health indicators that correlate to or predict the social, economic, or political state of a country. In Somalia, women suffer from unrequited social and political unrest and an enormous gender inequality gap. According to UNICEF, 1 in every 12 women die due to pregnancy-related causes or during childbirth. Pairing the mortality rates and lack of family planning with the ongoing political unrest presently leaves women with no choice but living in poverty with low quality of life. A solution that can be implemented to improve the lives of Somali women is to empower women through sexual health education and providing access to quality health care. By moving women's issues from the margin to the focal point, we believe that women will be more likely to identify health issues during their pregnancy and seek medical help. Not only will a program of sexual health education and maternal health care save many lives, but it will also sustain the livelihood of their children. By providing health care, health education, and sexual health education for women, the entire country will benefit from the increased awareness of health issues. Our women's health care units will induce matriarchal-based healthcare education. As said by Charlene Hunter-Galt, if you educate a man, you educate an individual, but if you educate a woman, you educate a nation.
Currently, compared to other sub-Saharan countries, HIV and AIDS are not a big problem in Somalia. But one can see from this graph that the HIV rate is constantly increasing. Therefore, HIV and AIDS are sure to become an immense problem in Somalia, and it is imperative that preventative policies are put into place so that this does not happen. One of the reasons why the numbers of people in Somalia with HIV is increasing is because of the high rates of HIV in their neighboring countries. Also, little is known about HIV and AIDS, and there's a stigma placed on people who admit to having the disease. Therefore, education is key to keeping rates low in Somalia. Teachers need to be trained to be able to administer health education so that youth are aware of the disease. Religious leaders should also be educated so that they can teach their followers about the disease. There will also be classes available to women to educate them about preventing mother-to-child transmission. By educating as many people as possible, the stigma of having HIV can be removed and people will be more open about their status, further protecting Somalis. We plan to spend $1.5 billion to set up testing centers in urban and rural areas of southern Somalia that also provide counseling to people who test positive because currently access to healthcare services are very limited. These testing centers will also provide free condoms and antiretroviral therapy to people who are already infected. The money will also be used to hold classes to educate the teachers, religious leaders, and mothers of Somalia.
Agriculture is the largest economic sector in Somalia and contributes to an estimated 2/3 of their gross domestic product. As a result, 65% of the country's workforce is employed in agriculture, and due to this heavy dependence, those who are involved are nomadic and follow seasonal patterns because there's little rain and their lifestyle depends on water. Yet there are some rain-fed farms in the south. However, it is not sufficient enough for the economy to prosper. In order to encourage more small-scale farms, we're going to use $1.5 billion to implement microcredit institutions across southern Somalia. They will be able to use this money to create more small-scale farms. Families will be able to go further than the current subsistence agriculture, and there will definitely be a surplus. This surplus will be used to trade within the region as well as commercially. It is also much more sustainable and safe. To ensure that these families are responsible and do not exploit the loan system, we have created a social contract that states that they must use the resource to improve their agriculture methods or they will lose their funding. Additionally, we will use $0.5 billion to introduce new strains of plants such as sorghum that are heat tolerant and resistant to droughts, and another $0.5 billion to provide advanced tools, and we will even select Somalia team to teach families how to use these tools. Now, since these families have additional resources, they will obviously produce more. There will be an overproduction of food, which will lead to food prices becoming cheaper, and this can easily decrease levels of starvation and death across Somalia.
After decades of war covering Somalia, the central government has collapsed and left the education system in ruins. 90% of all schools were physically destroyed during and after the war, which has led to 2 generations of Somali children that have not had the opportunity to learn. This has led to a declining literacy rate, which is currently 37.8%. This sharp decline in literacy among Somali people is explained by only 41.8% of children being enrolled in primary school and less than 8 in secondary school. This means that 80% of children are not going to school. In areas where Somali parents and community leaders want to rebuild the education structure, they lack the necessary resources to do so. Also, many unqualified teachers are overwhelmed and challenged by the extremely large student-to-teacher ratio of 33:1. Our plan is to use $4 billion to build a program that encourages volunteers from around the world to help rebuild schools throughout Somalia. Also, we will send qualified educators to not only teach future Somali teachers, but also help develop a fundamental standardized syllabus and curriculum for teachers to abide by. $2 billion would be used for all supplies necessary to build the school buildings, while $1.5 billion would be used to buy adequate textbooks, schooling supplies, and the institution of standardized curriculum. And $500 million would be used to pay for the travel and hours of work of all educators coming to teach the future Somali teachers. Education may be the key to rebuilding a peaceful and prosperous Somalia, and with this grant, TERP Serving Somalia aims to do just that.
We know that it will take time and effort to make change in Somalia as a country, but our plans will create results in southern Somalia that will improve the lives of millions of Somalis.